right, welcome everyone. I am really excited. You are in for a treat today because I have a very special guest sitting with me. This is Dr. Jaime Zuckerman, and she's someone I connected with. I think we connected probably a couple years ago, Jaime, maybe more. And I have been following her on Instagram primarily, where she's just chock full of amazing treats. This is a incredibly bright and talented professional who comes with a sense of humor, a lot of cleverness, incredible thoughtfulness, a well of compassion, some really deep and meaningful work for her clients and the people she serves. So I am so thankful that she agreed to sit down for this special guest interview for all of you. So let me tell you a little bit about Dr. Jaime Zuckerman, and then we'll get into it. She is a licensed clinical psychologist. She is nationally renowned expert in narcissistic abuse, highly sought after relationship coach for those experiencing narcissistic abuse, as well as the owner and founder of the Z Group, a private therapy practice specializing in anxiety, depression, and complex relationship dynamics. Dr. Z, as she is famously known, is the author of 2 interactive workbooks. And I have to tell you, these books landed on my desk by way of a client. And you got to get these books. I mean, they are interactive. They are beautifully illustrated with great tips and ways of just looking inside ourselves. I'm going to let Jaime talk about these books because I really want to introduce them to my own online community and have the members practice along together with me in using this book, both of them actually. The first book is called, they're workbooks, and the first one is called Find Your Calm, a workbook to manage anxiety. This book garnered great success, prompting her to pen a second workbook titled Find Good Habits, a workbook for daily growth. And I love this because the first one makes me think about really, strengthening your inner core, really getting yourself kind of sturdily prepared to begin to really pay attention, investigate, observe, and think about these longstanding patterns that can create fear going forward into the world beyond difficult relationships. She is an accomplished and active media contributor, as well as an influential social media personality in the mental health space. And she is quite an influencer on social media. So thank you, Dr. Z, for being with me today.
Thank you. That was probably one of the nicest introductions I've ever gotten. Thank you so much. Thank you for having me.
It's such a pleasure. So let's jump in. I like to keep this informal and more dialogue-like and let everyone get to know you, get to know your work and your contributions. Let's talk about those 2 books. Tell me about what prompted you, about your inspiration. Maybe we need to backtrack a little bit into your inspiration for, getting into this whole milieu of narcissistic abuse.
Mm-hmm. Yeah. So, the books kind of came later, obviously, but when I started private practice a bunch of years ago, and at the time, I saw a lot of mostly women, but also men with a lot of relationship issues, right? And most people were coming in because they were anxious or they were depressed. They weren't coming in saying, I have relationship issues. It was more kind of I like to say kind of the secondary stuff that comes from the relationship issues. And over the years, you start to see patterns in a lot of the people that were presenting to me. And it ended up that a lot of these, again, mostly women at the time, were describing these very kind of, I like to say, blueprint type patterns. Mm-hmm. And, I knew narcissism existed and narcissistic abuse existed, but, and I don't know about for you, but at least during my training, it wasn't something that was really talked about clinically. It was talked about more as diagnostic criteria. And we focus on other personality disorders. We never really focus on narcissistic personality disorder. And it's a shame because it's such a, I think, underdiagnosed and underserved kind of area. And so when these patterns, started coming into my awareness and realizing kind of what exactly I was dealing with here, you can't, and this, you can't treat those types of relationship difficulties the same way. Mm-hmm. In fact, you have to oftentimes do the exact opposite that you would do for a relationship problem where you're dealing with somebody who's toxic, who has toxic patterns, who is even abusive, but is not a narcissist. So there's these very subtle differences. And it was just so nuance based. And over the years and kind of working with women in these situations, I realized there was just such a need, not just a need for the type of therapy, but a need for clinicians to understand the nuances of these behaviors, because if you don't notice them, you can really do a lot more harm than good with good intentions. Telling people they should go to couples therapy together with someone who's not aware of narcissism, or, you should try to have date night, or you should try to listen more. And it seems like they're really working on things, but really they're not, so it gets very confusing, I think, for people. And then when COVID happened, when there was the lockdown, nobody was allowed out and their only access was social media. That's when you saw domestic violence rates skyrocket, and you saw substance abuse skyrocket, and depression, anxiety. People were stuck home and their outlets were taken away from them. And, that's, I think, when I started really posting stuff on Instagram about this, because there was such a need, and people were starting to share their stories and realizing that they weren't alone. Because this is one of those things where it's not people just complaining that their spouse is a jerk or their spouse doesn't listen to them. These, I find, and I'm sure you find this too, these are people who don't talk about it. One, because they may not even realize anything's wrong. Two, they can't see outside. So they're in this bubble and they don't realize that they're being manipulated or gaslit or controlled or even abused. And they really don't see it until someone pulls them out of it. And there's a lot of shame and a lot of guilt. So people don't talk about it. And I still to this day will say that survivors of narcissistic abuse are hands down the strongest people I have ever met. Because once you see it, you can't unsee it. And once you work your way through it, it's always going to be something you have to deal with. But they are some tough cookies, really. Like, I mean, they can handle a lot. And so I just really wanted to give people, I like to look at it as kind of preventative medicine almost, to give people the signs and the symptoms of love bombing and the symptoms and the signs of narcissistic behavior within families, so that they're able to see it, acknowledge it, predict it, and formulate a response to it, rather than getting sucked in and years later having to figure this out, if at all.
Yeah. Wow. You said about 100 really important things in there that my brain was trying so hard to hold on to, so many of them so I could comment. But I mean, the one thing that's, I think, really important to our listeners is that it is a horse of a different color. Yeah. And that you're not just going into therapy if you're even lucky enough to get, the narcissist to go into therapy.
That's right.
You're not going into therapy with someone who is just difficult. You're going in with someone who has an enormous amount of entitlement.
Yes.
And so everything is justified, everything hides behind denial, and everything hides behind blame of the other. The other really important thing you said too, Janie, is that, people who are survivors of narcissistic abuse will miss it because they have been dedicating so much of their time to questioning themselves.
Yes, exactly.
Trying to fix themselves, trying to make themselves more desirable and better. And some of them, and maybe you can speak to this too, are actually survivors of betrayal trauma. So it's not just dealing with a narcissist, which is tough enough, but one who has betrayed you in the relationship.
Yes. And it's not just, it's even more than it's the level of betrayal is so, it literally changes your entire perception of the world, right? I feel like it's, somebody cheats or somebody steals money from you or somebody, does something that's so uncharacteristic of them, you feel, yeah, I can't believe this happened. How did I not see this? Yeah. With the type of betrayal and narcissistic abuse, it literally feels like the rug has just been pulled out from under you. Your entire world turns upside down. You don't know what end is up. And oftentimes you're alone because you've been isolated for so long. You don't trust your own perception of things. You don't know if you're right, wrong, or crazy. And that betrayal, it's jarring.
Yeah.
Absolutely. It's just jarring.
That's a really good word. Another thing too, since you mentioned how, we didn't learn a lot about this as clinical professionals once upon a time. Really, really good point. Not a lot of time or energy spent on understanding narcissistic personality disorder other than just clinical symptom profile.
Exactly.
And yet there's now it's like out there big time, right? The word is all over the internet.
Yes, that's another issue. Yeah,
I treat narcissistic men too.
Yeah,
so I work with people who are narcissistic, and so I might be one of the few hopeful ones, but of course with great caveats about what's necessary for that to happen. There's a lot of mythology on the internet too about narcissism.
Yes.
Right?
Yes.
You find that too with people reaching out to you?
Absolutely. I find people reaching out to me because, somebody can be, like, excuse my language, somebody could be an asshole. It doesn't make them a narcissist. You could have a very controlling parent. It doesn't make them a narcissist. And I think oftentimes we use the word so freely because it sounds more like, I don't know, it's like gives you more reason to be angry. It almost like it justifies people's reasons to be angry. And, I'll have people say like, well, are they a narcissist? Almost as if they're given that label, then it makes it okay for them to then end the relationship.
Yeah.
Right. And I always say to them, does it even matter? They did, and I always tell people to look at the function of the behaviors. They did this, forget what they said, but they did this, they did this, they did this. Does it matter what the label is?
Right.
They've done these things to you. Is that okay? Or is it just okay if they're a narcissist? Because then there's a reason behind it.
Oh gosh. Yeah. Well, that's
right.
Really important and really, really well said. And, let's really think about that. All of us listening. That's so important. It doesn't matter the label.
Doesn't matter.
The way that so many of the individuals that I've treated feel like, unless they're angry, unless they're in a state of anger, which God knows is an exhausting state to be in all the time, that they can't have the strength to make a decision to care for themselves. Like, I'm only justified.
Yes.
He's the narcissist and I'm angry. And now I have a path forward.
Yes. But here's the thing. I mean, I always tell people, don't ever make a mood your goal, because if you make a mood your goal, it's a moving target. It's fluid. I mean, I could wake up and be in a great mood, stub my toe on my kid's toy, and then my mood is gone right? Or I get into a car accident or whatever the case may be. And it changes like that. So, if you wait for a mood to happen to feel justified in your responses, it's you really give up the control over that. It's the other thing too, though, I think that happens with using the word narcissist so freely is that when somebody is truly dealing with somebody who is a narcissist or who is in therapy and they're a narcissist themselves, it's like they're worried to even say that because they don't want it to be like, oh, everyone calls themselves a narcissist. Like everyone thinks their boyfriend or girlfriend or husband is a narcissist, And so I think sometimes it even does the opposite, and it keeps people quiet longer because they don't want to go with the buzzword because, they don't want everyone to think they're just kind of, shouting it and there's nothing behind it. And so I think it does damage both ways.
Yeah, and it's just loss in a different form in terms of that chance to really grieve and explore and investigate what's possible.
And I think I will say this. I think one of the things that I, as a psychologist, just doesn't matter how good I may be or how good any medication may be or whatever. I don't think there's anything more beneficial to people who are in therapy for this to hear survivor stories. I think survivor stories are so critically important for people going through this. But I think it's very dangerous sorry. I think it's very dangerous when survivors or people who have had their own experiences with this dictate therapy on social media. So I think it's a double-edged sword, because I think what they're saying is so important and necessary. But I think when, you don't have, therapy is not just talking to somebody, and it's not just giving your experiences coming from your own personal standpoint. I mean, it's helpful to be able to understand things, but there's a certain process of therapy. There's a certain process you go through with behaviors and regulating your emotions that aren't common sense, even though it may feel like that. And so I think that you just have to kind of be careful where you go with that on the internet, with it being such a buzzword.
Oh gosh, I couldn't agree more. And there is a lot of that out there, which doesn't truly capture nor constitute what it takes, that process that you mentioned.
Yeah.
Painful,
very,
very painful, deep, raw emotional journey it's not just making sense in a logical way. Mm-hmm. There's logic for sure, but it's a deep emotional process of making links and making sense out of one's life. And, for the narcissists themselves who have been able to do the work, that small percentage that do, it's really important, that can be to some degree celebrated. Mm-hmm. We don't have to give them a parade, but, celebrate those victories, because they matter. So some of these paraprofessional stories on the internet can be a little dangerous. I'm totally with you on that. Let's talk about your books. I want to get into your books and what they have to say and what people can expect.
Yeah. So I was asked initially to do an anxiety workbook. And one of the things that I'm a firm believer in is that when you are working with any type of, anxiety, depression, or just even everyday stress, worry, whatever the case may be, that it's really important to, use what works, right? Mm-hmm. And it's really important to know why it works, and to know the mechanisms of change, and to know, why something doesn't work, right? I always ask people, okay, what worked for you? What didn't work for you? Why do you think that is? And it's important. And so, I was trained in more of an acceptance and commitment therapy model. So what that is kind of learning to sit with your discomfort and at the same time still do the behaviors that you need to do to obtain kind of what we call value-driven behavior. So if you value being a good psychologist, then you want to make sure that your behaviors align with those values. And anytime you engage in a behavior that goes in the opposite direction of what you value, you tend to put yourself more at risk for anxiety and depression. And part of this is it's understanding that emotions and thoughts don't dictate behaviors. They don't cause behaviors. They don't cause it. Do they influence it? Of course, but they don't cause it. Because a lot of times people think, I can't do this until I feel less anxious, right? Or I can't do that until it feels easier. And the problem with that is that, if you tell somebody who's clinically depressed that they need to feel less depressed in order to brush their teeth, they're going to have smelly breath for a very long time. So it's figuring out what you can do that doesn't make you absolutely petrified, and start super small and slowly engage in these value-driven behaviors, because you get something back from them. Realizing that nothing bad happens and that you can do this, it gives you that reinforcement. It makes it more likely you're going to do it again. But it doesn't mean we don't address thoughts and feelings. We do. But the difference with this is we don't have you struggle with them. So for example, somebody who is worrying a lot, let's say, instead of having them give the pros and cons for their worry, right? What's the likelihood this is going to happen? Well, when's it happened before? But logically, people understand their worry is irrational. They know that, right? They don't need me to tell them that. And they can give me all the pros and cons in the world as to why it'll happen and what's the percentage it'll happen. But all that really does, when you have someone with chronic worry, I'm not talking like an acute thing, but like this chronic, long-standing generalized anxiety disorder, let's say, or this chronic anxiety, they are masters at being in their head. They are masters at going back and forth with their thoughts. That's what they do all day. So giving them that as a strategy does nothing but keep them stuck even longer. And so what this does is it teaches people to acknowledge that their worry's there, but gives them these strategies to kind of separate themselves from the worry, give up the struggle of trying to get rid of the worry, but instead learn to carry it differently. And it really helps people to stay more present focused. It teaches them to learn to sit with their discomfort longer so that they're able to do the things that they're scared of, so that they're able to do the things that they don't want to do, and at the same exact time feel uncomfortable. And it's so empowering for people to realize, wait, I can do this and feel uncomfortable at the same time. Oh, wait, what does this mean? What else can I do? And it's just a kind of a different way to tackle anxiety and depression. And I find, particularly with the clients that I see who are in these abusive relationships, or either realizing they're in it, currently in it, or out of it and dealing with post-separation abuse, or just dealing with it, that they come into these situations with such a lack of sense of self that was once there and probably really strong. And they've lost this sense of identity, this sense of who they are. To have them challenge their thoughts when they don't even trust their own judgment is a recipe for disaster. So instead of that, it's having them sit with that discomfort and look at it differently, slowly start to feel better and more confident, and bring out that self-identity and kind of, dust it off and pull it back out. It's a much easier process than having people try to challenge their thinking and their feelings, because they don't even believe what they're feeling to be. They don't even know what they're feeling. They can't even identify it.
Yeah, I'm keep muting myself because as Jamie and I discussed earlier, I have construction overhead. If you're hearing that little buzzing sound in the background, it's because they decided to do this on the day.
It's not bad. Yeah, it's actually not bad. It's not bad at all.
Okay.
No, not at all.
Worse on my side. But
yeah.
Anyway, I loved what you just said, and I couldn't agree more that the challenge will feel futile if it's really embedded in the core. Yeah. And either because it's an old pattern that has been around for a really long time, since one was a little girl or little boy, or it's one that's just become very robust as a result of living with a narcissist for a very long time. So, or both. And in this case, I really like what you said. And I think it actually goes even further than that you can sit with the discomfort, you can continue to do the things that are important, that you value. You can live in your life, you can live in your skin.
Yeah.
But you also can experience joy.
Yes.
Right? So there can still be joyfulness, even though there might be darkness over there.
Yeah. Right? Absolutely. And that's the thing. I think we're taught at such an early age, and I think it's a function of our society, unfortunately. And I think it's slowly getting better, but that we should always be happy. Right? Like we hear these say positive vibes only, and, stop worrying, and it could be worse. And it's so invalidating. And so people grow up with these messages that feeling bad is bad, feeling sad is bad, that there's a time limit to it. And the effort to try to not feel sad, and the effort to try to push away very normal emotions like anxiety, gets us into trouble. That's what gets us into trouble, is the avoidance of these things. If we didn't have anxiety, I always say this, we'd be dead. We'd walk across the street and not look both ways, because there'd be nothing to force us to do that. Anxiety gives us information about our world. So without that, we'd be very uninformed. And we think that we can cherry pick the emotions that we want to have. I'll have people come in all the time. Okay, what's your goal? I want to be happy. And I'm like, great, me too. But but what would that look like if you were happy? What would you be doing more of or less of if you were happy? And then we start to focus on things like, well, I'd probably be going out with friends more. Okay, how many times a week? 5 days. Well, how many are you doing now? None. Okay, so let's start maybe with 30 minutes once a week, right? And to do these things and get the joy from it, and realize you can have two emotions at the same time, right? And that life is the experience of all these things, right? And a good life is experiencing all of these things. Where we get into trouble is when we try to suppress very naturally occurring emotions.
Yeah, oh gosh,
and it's much easier said than done, right? As I say that,
it's much easier.
I don't know how much I do it, but
yeah, but these are really precious gems. So let's pare it down to some of our listeners who are living with narcissistic partners, who are still choosing, because again, we make our choices every day, every moment of the day. We can choose and unchoose and change our minds, but they're still choosing to be in these relationships. Some because it's just not safe to leave their children yet with the narcissist. Some because they want to see what's possible. But at the same time, they're living with a deep sense of loneliness, even anxiety about, will I ever really have a companion here? Will I ever have a companion again if I leave this relationship? So there's a profound amount of loneliness going on in everyday life in this relationship, or even those who've stepped out. How, if they're not ready yet to make the bold change, the radical change, do they sit with that loneliness and have something alongside that can resemble a sense of joy or peace or calm, to use your book title?
Yeah. I think it's super important to look for things that you do have control over. And I always tell people to start there. Start with the things in your life that you feel you have control over. For some people, especially within a narcissistic relationship, they may not even have control over what foods they eat. And they may not even know that that's something they don't have control over, because it's always been the narrative. We eat this. We watch this. We listen to this. Because afterwards, all people say, I don't even know what my favorite flavor ice cream is. I don't even know what style of dress I like, because I've been told this my whole life. So, I think it's looking for the things that you can control. And and I know this is going to sound ridiculous, but this is sometimes where you need to start. If that's, do I do the laundry at 1 o'clock or do I do it at 3 o'clock? It's the illusion of choice. Like, our brain can't tell your brain doesn't know that it's, laundry at this time or this time, but it's the impact of being able to make a choice. And it's a choice that you picked, and it's something that the conditions that you established, and it's empowering. And it's like these small, tiny steps to kind of make you realize that you do have control over things. And at the same time, that feeling of loneliness that you have is like a disconnection, right? And it's like a lack of control around the world around you. And so if you slowly start to make these changes within, this system that you're in, if you're not yet ready to leave and you have no idea how to do it, or it's not safe, making these small changes gives you a sense of empowerment, and it gives you that encouragement, so that when you do get to that point, it's not like you're going from 0 to 60. You went from 0 to 1 to 2 to 3 to 4. And by the time you get there, it doesn't seem as hard. It'll be hard, but not as hard. And as far as the loneliness goes, one of the things that happens, particularly in these types of relationships, is that deliberate social isolation, so that they really do have control over you and your mind and your thinking and who you have access to. So things like let's say that, you, and I know people are like, what do you mean you're not allowed? But let's say you're not allowed to make plans with other people, right? You know that if you do, there's going to be hell to pay afterwards, or whatever the case may be. Things like going to your mailbox. I mean, this is where I've started with people. Walking to your mailbox to get the mail, and maybe there's people walking by. You have conversations with them, right? Or you go to the market and you purposely over interact with people to have conversations with them, right? So that you at least can connect with people, maybe not on a deep level, but to know that you exist because people are interacting with you. Because for so long, you probably felt like you don't exist. You have no sense of identity. Your identity is wrapped up in taking care of this one or keeping the peace. And when you start to connect with other people, even superficially, you realize like, oh, wait, I exist. Okay. I have my own views and thoughts and feelings, even if it's a stranger at the supermarket. And that's where you start.
That's great. That's great. I mean, in your these books, remember everyone, are workbooks. So in your book, Finding Calm, you have a lot of strategies and a lot of tools and tips and things that one can actually write in the book. And
yeah.
Is there a favorite for, someone who is living with a narcissist and just feeling the heaping amounts of, anxiety that come with decision making and carving out space for themselves for some peace and connection.
Yeah. I love starting with I think worry art. It's in the beginning. I think it actually may even be the first one because it was my favorite. But it's a really good starting strategy because it's a skill set. It's teaching you an actual skill set that you can use. I'm very big about starting small and going big. So it's a skill set that you can use to start to apply to other areas. And it teaches you, how to take all that ickiness that you're feeling every day, all day, it feels like, and putting it outside of you. You're not getting rid of it because you can't, right? You're not struggling with it because you won't win. You're not trying to push it away because it'll seep out. Instead, you're learning to take it and put it next to you and look at it so you're untangled from it. And when you're untangled from something, you can look at it so much clearer. I mean, that's why people come to us, right? They're so entangled in their stuff, they need somebody objective to look at it. And so that's what this does. It allows you to take all that ickiness and it gives you a vacation from it. It gives you that space where you can actually breathe. And it takes the heaviness off of you. And it basically asks you to, sit with all your discomfort that you have for a minute, and I want people to feel so uncomfortable, right? But knowing that they're safe, reminding them it's only 60 minutes and sit with all that discomfort. And at the end, I ask them to, I have a whole list of descriptors. If that pain that you felt had a name, a human name, what would it be? If it had a color, if it had a shape, and there's a whole bunch of categories. And what it does is it takes that ickiness that's just seems infinite and just seems huge and just unmeasurable, unmeasurable. And it gives it a form and it gives it an image. And so it's you can visualize it and you can look at it. And so when you start to feel that, I did this with one of my closest friends, and she always lets me use this as an example, but she was dealing with divorcing a narcissist, and it was brutal. And it was a night before going to court, because that's what happens with these. They end up going to court. So it was the night before going to court. And I did this, she's like, give me something. I need something. So I told her to do the warrior. And from crying about this, she started laughing 10 minutes into it because it was so absurd how she was describing the feelings she had. It was a slime. She called it her ex-husband's name, the slimy oval that smells like whatever, eggs. And so every time she got that feeling or she started having the racing thoughts about him, she pictured him or the feelings as this slimy, egg smelling blue oval. And she would just start laughing. And I say to people, you're doing better when you can look at this behavior and start to laugh at it because it's so ridiculous, right? Yeah. On the other side of it. And so this kind of helps you do that in a way, in a sense. And it's a good skill to have for anything, because as long as you can take all that ickiness that you're consuming yourself with and stop trying to get rid of it, but instead put it here, it just gives you this freedom to be able to move around with it.
Absolutely. Gosh, yeah. And as you said, you take it outside yourself. And once it's outside yourself, you've already now become a bit more liberated emotionally. And when you're liberated emotionally, you can be a little sturdier. And in that vein, you can take seriously what you need to do to care for yourself. If you're going through a divorce, you're protecting your children. Now you've got, your mind is working again. I love the idea of being able to laugh about it, because laughing about it and seeing the absurdity is not to say you're minimizing the importance of the problem, right?
Correct. It's that you're able to look at the predictive, because here's the thing, one thing I will say about narcissistic personality disorder is that as different as people may be, the symptoms are so damn similar. It's always been so, I hate saying fascinating because it's a terrible thing, but so fascinating to me that it's such nuanced behavior, but it's so identical across people. It's mind numbing to me. And I think that when people realize that they can predict it, it gives them this control, and they realize how predictable it is. And they realize, wait, I know what they're going to do. And they'll be like, oh, you said they were going to do this and they did this. And they get this empowerment, and it makes them feel stronger. And then they feel like they can stand up against it. And it's this process where eventually you get to the point and you're like, that's all you got?
Yeah.
Right. This is what you're going to do again. Oh, it's my birthday, like clockwork. There's the phone call to ruin it. I mean, it gives you that power.
Yeah.
But,
And it sort of overrides this idea that we are incapable of confrontation, and not just confrontation that means you're yelling at someone or speaking out in an aggressive tone. You're just being more assertive, or you're just taking something in and noticing and setting a limit or stepping away, but you're doing it very deliberately. And I think you can do that when you can predict what's going to happen. It's not what the person's doing that's the issue. It's that you can tolerate it.
That's
I can tolerate it.
And that's what this is all about. It's about tolerating discomfort. And you brought up a really, really good point. When you're able to separate yourself from this and give yourself that space and that flexibility, it frees up your brain space. And then you can actually attend to things that you actually enjoy, right? That you actually get pleasure from. So not only are you freeing up space, but now you're getting reinforcement from things that you enjoy. You're getting that feel good chemicals, and you're reducing your cortisol levels because you're not anxious anymore. And it's this cycle that really starts to kind of just take on a life of its own once you separate yourself. But I think people too often try to get rid of bad things instead of sitting with them, which gives you so much more flexibility.
It's like reshuffling the deck or something. It just becomes, it's still important, but it doesn't have to overpower or overwhelm.
It doesn't have to own you. Exactly.
Yeah, so, I mean, these strategies are so beautiful. Can differentiate this book from your other book. I mean, I love, as I said earlier in the introduction, I love the idea that when you can do what's necessary to have this vessel be kind of more empowered, more prepared, more able to kind of spot and see and know and predict and experience life from a different angle, then, I think the next book becomes so interesting when it comes to like looking at patterns, finding good habits. I mean, that's the title of your book, right? Find good habits. Talk about the difference between the two and how, especially for those who are stepping out in the world again and saying, I don't want to do this again. I don't want to like fall prey to the same bad behaviors and bad chemistry that was out there for me before.
Yeah. So I think it's really difficult, if not borderline impossible, to be able to observe your patterns and other patterns when you're not able to be present. In order to see patterns in your behavior and other people's, you have to be very mindful of what's going on in the moment. And if you're up here in your head, on robot mode, you're not able to see these patterns. And that's where we get kind of, when things get really chaotic and hectic, we go back to what's familiar because our brain's on overdrive and we just do what we know. And that's why in stressful situations, we go back to what's familiar. So it's really important to first learn how to take that pause to kind of calm yourself, which is kind of the first book in strategies to do that. And then be able to acknowledge patterns, acknowledge your own patterns, acknowledge what your triggers are. There's so many times where all people say, I had a panic attack. I don't know why, right? It was out of the blue. Or, I'll just use that as an example. And I'll say, well, what was going on right before, after? Nothing. I don't know. Okay. Well, what were you thinking about? Was there a smell? Did your body temperature change for any reason? Were you in the shower and then you got out? Like, oh, wait. Yeah. Right. So there's always a trigger and you'll never be aware of it if you are constantly in your head. And so I think that it's in order to know your triggers, know your patterns, and to know what you value, to be able to even set your goals, you have to be present. You have to be, or else you have to
just get to a state of presence, right? Where even if you're kind of a work in progress, which we all are, I guess, to a large degree, forever, right? You may come back from a situation where maybe you were on a date, as I like to say to my clients. It's a discovery mission. You come back and you say, wow, now that I'm looking at this and I'm reflecting and I'm really present, I can see that, like, I let that individual interrupt me probably 10 times and I did nothing about that. Yeah. I said nothing about it. I just smiled through it and allowed myself to be interrupted. Look at that pattern, right?
Isn't that interesting? I was like, isn't that interesting? Or isn't that curious? And, you know, and not judge yourself for it. We're going to do what's familiar to us, and not because we're bad people or we're not smart, or it's just because it's easy.
Yeah. Wow.
Gosh, I mean, so much. You've given us so much, and I'm aware of the time. I know we're running out of time, but I could listen to you for hours.
And so we'll do it again for sure.
Yeah, we'll do it again. I want to say to everyone who is listening, though, please get the books. Take a look at these marvelous books. Listen to this amazing woman and all that she has to share. Tell people where they can find more of your goodies, more of your resources, Jane.
Yeah, sure. So I post a ton of stuff on Instagram. That's Dr. Z_psychologist. My website for relationship coaching, drjaimezuckerman.com. If you're in the Pennsylvania area for therapy, our therapists are outside of Philadelphia, and that website is zgrouptherapy.com. And then, my books are on Amazon, Barnes & Noble, wherever you get your books. And then I had done a podcast for a while. We stopped that one. I'm starting a new one. It's launching hopefully in the next couple of weeks.
Good.
So be on the lookout for that. And I'm pretty excited about that. So
you'll send me the links so I can share them with everyone as well.
For sure.
Yeah.
Yes.
Any final words or tips or special phrases or anything you'd like to share before we go?
Yeah, I just be patient with yourself. That this is a process. It's all a process, and you're going to feel like, people say, "Oh, I messed up," and I feel like I went back 20 steps. You didn't, because you're coming from the fact that you even acknowledge that is huge, and the fact that you're going back not to the beginning, but you're going back maybe 5 steps, and you're starting from a place of, we like to say, you're starting from a place of experience and more knowledge than you had before. So understand it's a process. Don't beat yourself up. Don't judge yourself for it. And just take it slow and be kind to yourself during it, because you're doing it. If you're listening to this, you're already doing it.
Ditto to all of that. That's great. Jamie, thank you so much.
Thank you so much for having me.
Dr. Jaime Zuckerman, everyone, and I really appreciate it. It's been a delight.
No, thank you for having me.
Take good care.